Well, hello and welcome to another episode of RTMatters, where candid conversations take place about what matters most to respiratory therapists. I'm your host, Patrick Dunne, and we're delighted to have you join us for another episode of RTMatters. And just as a reminder, this as well as all prior episodes of RTMatters are available in your podcast app of choice. It's open access, no charge, no subscription fee, no membership requirement. So let your fellow RTs know about us and how we can help you maintain a sense of balance. Well, on to this episode. You find yourself stressed out over work-related stress? Is work-related stress affecting your mental and physical health? And there's no shortage of stressors in this environment that we find ourselves in as healthcare continues to transition away from counting things to looking at value-based healthcare, which is creating significant challenges. Chronic unresolved stress, however, is a precursor to a more serious consequence, which our invited guests will talk about, which is burnout. And it doesn't happen overnight. It's something that builds up over time because of unrequited stress in the workplace. And about 70% of RTs report some degree of emotional exhaustion and burnout. Well, our guest today is just the right person to help us wade through the consequences of chronic work-related stress and what you might consider doing to reduce the impact. Joining me is Dr. Katlyn Burr. She is a registered respiratory therapist. She is also a sleep specialist as well as a certified asthma educator. And in 2004, Dr. Burr was inducted as a fellow into the AARC's Hall of Fame. She is a senior director of respiratory care at Sleep Medicine and Biomedical Engineering. You have a full plate, I can tell, at Nemours Children's Health in Wilmington, Delaware. Katie, welcome to RT Matters.
Awesome. Thank you so much, Patrick, for having me. And I'm super excited to talk about this topic today. It's something that everyone has to deal with. I haven't met anyone who has been able to eliminate stress from their lives. So if this is something that every human is having to deal with every day, and I think it's super relevant, especially for healthcare workers in high stress fields.
Yeah, I just wanted to point out that you are also very much involved with the AARC. You're a member of the 2026 Program Committee, which is getting ready for the New Orleans meeting. You're also a member of the Safe and Effective Staffing Guideline Committee, and you're also the co-chair of the Emerging Leadership Committee program. So you're really very much involved in helping the future of this profession establish a very sound evidence-based fundamental. I should also point out that I heard your presentation in Phoenix last year about managing burnout. And the reason that I mention that is because you were the co-author of several articles in respiratory care that dealt with burnout, and primarily at the beginning of the COVID epidemic and also more recently in 2023. But you also had your own article published as a solo article when you published it in 2000, Occupational Induced Traumatic Work Experience for Respiratory Therapists. So you really have a great background. But before we get into the topic, I wanted to always ask our invited guests to briefly share how you got into respiratory. Did you find it or did it find you?
Probably a little bit of both. What a fun question. I think everyone has a fun journey and story about how they ended up here as a respiratory therapist. I became a respiratory therapist after my grandmother had an accident. Her and my grandfather live very close to me. We've grown up very close, and they are a bit what you call frugal, in the sense that they are not going to pay more for something or extra for something that can be replaced or repaired. And so they had their refrigerator repaired multiple times and eventually decided, okay, enough is enough. It's time to get a new refrigerator. And because they are frugal, they decided, well, we're not going to go to Best Buy and buy a refrigerator. We have a local Sears Scratch and Dent that used to be open. And so they said, we're going to go there. Mm-hmm. They took their truck, they picked out a refrigerator, and they went to pull up to the loading dock. My grandmother is about 5 foot tall, standing on her tippy toes. And so she was kind of standing in the loading dock as my grandfather backed the truck up, kind of waving him in, and she got caught between the loading dock wall and the back of the truck bed.
Wow.
When that happened, she obviously had a medical emergency. An ambulance was called. She had a flail chest and pulmonary contusion. She had cardiac contusion. She was in an ICU for multiple weeks, multiple chest tubes, and ended up in rehab for a few months after that before she was able to go home. She's alive and well today. My grandfather has since passed for other reasons, but it was really that experience as a young adolescent finishing high school and spending a lot of time in the hospital and seeing her during her recovery that I learned about what respiratory therapists were. And truthfully, they were the only people who were happy every single time. I saw them in a room. They were happy.
We need more of that now, don't we? Yes.
We certainly do. They were always happy to answer questions. They were always encouraging. There was always something that they were going to do. They seemed like they were always helping someone. And so ultimately, that's really where I learned about a respiratory therapist and decided that that's what I was going to go back to school.
Where did you get your entry-level training?
Yeah, I graduated from Delaware Technical and Community College with an associate's in respiratory care. And that's kind of how I started my journey.
Mm-hmm. I noticed after you obtained your registry RRT, you also went for the specialty credential for neonatal pediatric and also a certified asthma educator. What prompted you to go beyond the RRT credential and get those additional specialty credentials?
Yeah, I actually started my career in 2010 with a CRT, and I was the first person in my family to go to college and to, have a career in something that they chose to do. So really, I graduated with my associate's degree and a CRT thinking like, I never need to learn anything ever again.
That's right.
And it wasn't until about 3 years into respiratory and my journey in the field of respiratory care that I applied for a job as a specialist for the emergency department, and I did not get it. And at that point, I said, okay, well, how do I make sure I'm ready for the next job? And so in 2013, 3 years after I graduated, I went back, studied for my registry, got some specialty credentials, signed up for a bachelor's degree program, and really said, I'm going to make sure when the next opportunity becomes available that I'm the first choice.
You're ready.
I'm doing everything I can to be ready for that.
You also later decided to even continue further your academic education, earning your doctorate degree in strategic leadership. Now, same motivation, I would imagine, higher position goals for yourself?
Yes and no. I think my master's degree that I got in healthcare administration definitely aligned with, that's what's expected in a leadership position, and I want to be ready. My doctoral degree was a bit of a bucket list item. I actually debated a whole lot before I went back to school for my doctorate because my oldest is 21 and he was going to graduate high school as I was thinking about going back to school for my doctorate. And I said, is this really what I want to do? Like, I'm still going to be going to school after my oldest kiddo is done high school. Like, we're going to be in college at the same time. But ultimately, it really was kind of for me, not for a job, just for personal satisfaction to say that, I have this skill and expertise that I'm able to do this. And really, continuous learning is something that I find super valuable. I feel like it keeps our minds fresh and agile. It gives us the opportunity to continue mentoring and growing others. And so that one really was just for fun.
Yeah, right. Well, I'll tell you, it certainly played out well for you. And I wanted to remind our listeners, everyone who talked to us about this either has observed a respiratory therapist taking care of a family member or themselves, or has known somebody who looked at a respiratory therapist. So I always tell our listeners, make sure you understand that you are on display. And you might be impacting people who might want to come into this profession in a very positive way. And like you say, they were very happy and you were there. And of course, today the challenges are much, much different. I also point out that one thing you reemphasize that others have said is that wasted time is the one thing you never get back. And you took advantage sooner rather than later to continue your education and you advance your profession. And I think that's really an important message for our listeners. All right.
I think as I tell people or, engage with others who are considering going back to school or considering getting another credential or spending time and exhibiting effort into anything is there's never going to be a perfect time. Sometimes, people are waiting for, when my kids are in school or when I finish this. Sure. There's never going to be a perfect time. And so if you're deciding that something is a priority for you, do it. Don't wait. Right. It won't get easier. Time will not magically appear for you. And if it truly is a priority, you will rearrange. Humans are wonderful at figuring out how to get the most minutes and hours out of the day.
And it means more to you when you work extra hard for it. And it reminds me something you said earlier. One of my favorite lines from the Pink Floyd Time from the Dark Side of the Moon is one day you wake up and find 10 years have gone behind. No one told you when to run. You missed the starting gun. So you can find all kinds of excuses, but eventually at the end of the day, you really have to make a decision what's best for yourself personally.
Yeah.
Well, Thanks so much for sharing that with us. Now, as I mentioned at the opening, you're very qualified to talk about this, and we're going to identify the physical and psychological impact of chronic work-related stress and some mitigation strategies worth consideration by all RTs, regardless of your practice setting. And I'm not just talking about the high stress of the intensive care unit, the pediatric unit, but home care, continuing care, rehab, dealing with patient behaviors that we try and change, and of course, dealing with staffing shortages. Let's begin by defining what we mean by work-related stress for a respiratory therapist.
I think work-related stress is the same as all the stress that happens in your life at home with your kids and what's for dinner and how do I keep my house clean and there's lunches to pack and laundry to do and the water heater broke. It's all of those things that cause stress in the day-to-day just in relation to your workplace. And so if you had to kind of think about the things that cause you stress, a lot of times for respiratory therapists, working in a population that isn't your favorite, having your assignment changed in the middle of your shift, having to do the work of more than one respiratory therapist in the same shift, having to collaborate with team members from other disciplines who maybe aren't as open or as partnering, having to operate in an environment where you don't have all the autonomy that you know you can have or you should have.
Yeah, you're really kind of differentiated between acute stresses, everyday living stresses, caught in a traffic jam, a near miss, as opposed to the chronic ones that are long-standing, which are work-related. The acute ones we pretty much solve pretty much in a normal manner, and we'll talk about adrenaline and cortisol here in a moment. But I think that's a big difference. What you're emphasizing is that the work-related stress can actually overflow into your personal life as well.
And vice versa, right? There are times where things are stressful at home that makes the workday feel more stressful, and vice versa. You are not a human in our fast-paced modern society. If that does not happen to you, I don't care how good you compartmentalize, you create boundaries. Living life is stressful, and all of the stress from any part of your life is going to carry over into another. And it's being able to manage all of those stressors, workplace or not, in an effective way so that that happens less.
Yeah. And again, the physical response to stress, let's stress that. That's one of the points that you got a lot of people nodding their heads when I was in that presentation in Phoenix, when you talked about the impact of adrenaline and cortisol and the long-term consequences of constant stimulation of those hormones.
Yeah. So I think the cool part about stress and stress management is that every human has the same biological and hormone response to stressors. Everyone's stressors are different, and that's the individual part of humans being humans. My stressors are going to be different than your stressors, Patrick. I don't like driving slow. You might prefer to go out on a Sunday morning for a leisurely drive. That for me would cause me immense stress. I prefer to travel from point A to point B as quickly as possible. So every human's stressors are going to be different. But once you encounter something that is a stressor for you, the biological response of every human is the exact same. It is not different, and it is on or off only. Collect, go, pass, go, collect $200, don't. It is one or nothing. And so once you encounter something stressful and your body says, this is stressful, I'm going to need to manage this, it does two things. First, it activates your body's fast response to stress through your sympathetic adrenal medullary system. And this part of your body starts secreting epinephrine and norepinephrine. These are all the things that happen when you fight, flight, freeze, or fawn. Our body is trying to make sure that we live. It says, don't die today. How do we make sure we stay alive? And so your heart rate goes up, your blood pressure goes up, you maybe get a little bit diaphoretic or sweaty. You start feeling kind of the bubbles in your tummy, and all those things happen as your body is trying to keep you alive in this stressful situation.
So it's a normal response that keeps the human species functioning. And that's really an important point. Some people don't have a better response than others, maybe handling it, but the initial response is pretty much biologically the same.
Absolutely, for every person. And then once your body starts realizing that epinephrine, norepinephrine, cortisol are secreting through your veins, it goes, okay, we know this is stressful and we can't do this forever. Let's send in some help. And so then our body starts our slow response to stress, and our hypothalamic pituitary adrenal axis is what kicks in here. And it causes our adrenal gland to start secreting cortisol. And cortisol is your body's fuel for stressful situations. If you only have the fast response to stress, the human race would be extinct because everyone would be having heart attacks and coronaries.
Sure.
No one would be in respiratory care.
So cortisol maintains the fight or flight balance until there's resolution of the stress.
Correct. It's what allows you to lower your heart rate even when things are stressful and be somewhat of a functional human when stressful things are happening all around us.
So eventually we're waiting for the autonomic nervous system is doing its job, but we're also now waiting for a parasympathetic system to come in with the calming effect. And that's
Correct.
what basically helps resolve the spike in those two hormones.
Correct.
All right. So now the emotional impact of chronic work-related stress. We talked about the physical. What about the emotional impact of this? For example, you see a lot of cynicism, especially on the posts and some of the social media accounts. And cynicism, it seems to me, is a kind of a negative reaction to stress rather than just trying to identify what's causing the stress.
I think the fun part about this is the way humans connect is hardwired. Human beings actually connect on things that are negative, and they feel more strongly and closely pulled to each other than they do on things that are positive. And so if we say, oh no, we hate something, we can hate it together and feel more connected rather than if we say the weather's lovely outside. And so we have an innate ability to want to share the things that we disagree with in the world, which triggers complaining, which is very similar to the stress response. So when we complain about all the things that make our jobs hard as a respiratory therapist, or all the things that aren't going well in our workplace or in our organization, what that does is it actually causes our body to secrete cortisol. And we've now told our body that this is stressful, that we don't like this. And so it thinks that we need to learn how to survive in this environment. And what we're doing subconsciously is telling our brain and our neural wiring that these things that are not going well are important to us. And we want to find more of them in the world. And so your brain continues to scan all of your environments to find all of these things that maybe are negative or aren't perfect, and it pays more attention to them.
Yeah, I tried to doing some research. It seemed to me that there's a whole body of knowledge now about how to properly complain instead of being a nitpicker, but actually have a suggestion and to not just complain to be disruptive, but to try and resolve the issues that are causing stress for yourself and for your coworkers. So there's a good way to complain, and you mentioned a not so good way to complain.
I think what people really should take away from complaining is helpful to you when it is used to identify a problem. Complaining is harmful to you as a person if you complain for more than 90 seconds and you don't shift into problem solving. And what it does from a human body anatomy response is when we complain and you secrete that level of cortisol in your nervous system, it actually reduces the size of your hippocampus and it causes shrinkage in your hippocampus. And in your brain, your hippocampus is your memory center. And when you shrink the size of your hippocampus, it actually increases your risk for neurodegenerative conditions like Alzheimer's and dementia. So when you are spending time in this negativity and complaining cycle that can lead to burnout and other negative effects for your body, you are actually harming yourself as a human and increasing your risk of those neurodegenerative conditions.
Yeah, we don't want cortisol levels to stay conveniently high because it has that detrimental effects on the digestive system, the neurological system, cardiovascular system, the neurological system. So it really is important. And I think you're stressing the point, pardon the double use of the word here, that we really need to be attentive to these disruptors and to these stressors and not just be stoic and forget about them and say, we're going to suck it up because everybody says that's what you're supposed to do. And you're harming yourself by so doing that.
Yeah, it's definitely about a balance and allowing yourself to recognize that things are hard or this is stressful or it's not my preferred reality, but then shifting quickly into how do I get to a reality that is more preferred? How do I change this so it doesn't happen again for the next person? How do I become part of the process for making it better?
We talked about the individual. How about our patients? Because one of the points you raised is that there's this thing called compassion fatigue or moral distress where it impacts how you take care and how you approach your patients. And that's really something that I find very discerning, because we don't even know that that's going to help us negatively as we approach our patients.
Yeah, I think all of this as healthcare providers has an impact on patients and the way that we care for them and their health outcomes. That's the point that probably is the biggest to drive home for respiratory therapists, because we don't think about those things. We think if we're just having a bad day, it's limited to us or to our team. And we may put on a brave face when we go into a patient's room, but what the evidence tells us is it still does have an effect on patient outcomes. When healthcare providers are incivil to each other in an environment, the outcomes for our patients decrease, and we make more mistakes, and we have more errors, and we have poor communication and delays in things that didn't have to be that way. When you think about compassion fatigue and the way healthcare workers continually take care of patients who are in situations that are less than ideal, we do take that home with us.
Yeah, we take care of some of the sickest patients and some of the most fragile patients. Life and death situations, literally, like with your grandmother, with your experience. And at the same time, back in the day, because we pre-COVID, with all the disruption that was caused, therapists were happy. And, you saw that, and it kind of motivated you. And I wonder if we carry that same facade into our patients today when you're carrying a lot of moral distress around in your back.
Yeah, I think when you think about compassion fatigue and moral distress, it's when the work that we do changes our perceptions and our worldviews. And so you might have gone into healthcare thinking, I'm helping only a small population of patients who will be sick this year. And over time, as you practice as a respiratory therapist, if that changes into everyone gets sick, everyone's going to die, everyone has cancer, right? And we're starting to let the work that we see every day affect our worldview and how we view things. We offer less compassion to our patients, number one, and to their family members, because we normalize that this is what's happening everywhere in the world. And then it also doesn't allow us to digest the situations that we experience every day in a meaningful and healthy way. We tend to then compartmentalize. We become more volatile in the way that we react as humans. If you notice that you are snapping or you're having outbursts or fits, those are generally because we are not processing things in real time and understanding their impact on us as humans, and really diving into, okay, I know I experience this every day, but what does this mean in the context of the entirety of the world? Truthfully, most humans aren't in the hospital. Right. Most humans aren't receiving care from a respiratory therapist, but because we're so immersed in that environment, we believe that this is what's happening in the general population all day, every day.
Yeah, one of the other aspects of this that you alluded to, but I'd like you to just drill down on it, and that is it's disruptive personal relationships and social isolation. When you're away from the job, you tend to withdraw, and that's not healthy, because the one thing you want to be able to do when you walk away from stressful situations is to be calm, to relax. And that's time you build this up, and all of a sudden it affects your personal life, which is a nasty, nasty spiral.
Yeah. And again, it goes back to all of this is related. If you're stressed at home, it carries into work. If you're stressed at work, it carries into home. And there is not a way, I've never met a person who's been able to kind of differentiate that. There's a balance about managing stress and managing emotion so that it doesn't get to the point of burnout, but it's not about leaving work at work and home at home. Mm-hmm. If you're trying to do that, balance. You're never going to get it right.
Yes.
It's again about acknowledging, processing, and balancing. Mm-hmm. And I think what you'll find in all of the burnout and stress research that's out there is the first step is really acknowledging that I'm experiencing a high level of stress, or I'm in a situation that is stressful. Here's the things that are happening in my body. And then being able to do some things to tell your body that you're not going to die today. Mm-hmm. Again, it doesn't know the difference. That biological wiring of sympathetic adrenal medullary system, hypothalamic pituitary axis, secrete these hormones, it is on or off. It is not like you can turn it on 25% of the way or 75% of the way. It does not know the difference between, a dead car battery and I'm getting robbed.
It's a trigger. Right? It's not a hose adjust. It's trigger, all or nothing.
Yes. And so it's recognizing that this is happening in your body and being able to differentiate why is it happening, and then telling your brain consciously or subconsciously, if you get really good at it, you can do it in a more subconscious way, that I'm not in danger. and I'm going to be okay.
Right.
And allowing your body to shut off the nozzle for those hormones that are being secreted.
Yeah. Now, you mentioned earlier, but I'd like to drill down on it because chronic diseases are really linked to persistently high levels of cortisol, such as hypertension, and you mentioned the gastrointestinal issues, weakened immune system, which of course is our safeguard. And what are some of the other physical consequences of long-term unmitigated work-related or physical stress?
Yeah, there's not anything that your body is doing that is not impacted by stress and high levels of cortisol and epinephrine and norepinephrine secretion. Hair loss, vision, teeth health, reproductive health, sexual health, bone health, cardiovascular health. Absolutely every process that your body is doing all day, every day is impacted by stress. If you have a symptom or a sign of something, chances are it could be caused by stress. There's no way to know, right, for sure until you dig in and you start understanding, but absolutely every bodily function, bodily system is impacted by cortisol, epinephrine, norepinephrine.
Yeah. And start those physical consequences, you start seeing them show up, and it leads to what we call mental anxiety, depression. The common term is brain fog, and then sleep disorders. I mean, this real and unhealthy behaviors, excessive eating, excessive drinking, recreational drug. I mean, so it really has a spiraling effect, both physically and psychologically.
For sure. One leads to the other. And again, probably most important thing you will hear me say today is having a good understanding of your body, being aware of what's happening, and be able to notice when you're in a situation that is causing you stress, and then to acknowledge and do something about it is the biggest tool that you have in managing stress.
And I'm going to emphasize that you said earlier, it's no matter what your profession, you could be the physician, the nurse, the patient, the family, you're all going to experience stress in the same way, in physiological way. And sometimes we compartmentalize certain, well, they don't get stressed. You know, I think some of the highest stress is in the operating room when there's an oops moment. Same thing in the C-suites when there's a budget shortfall. I mean, all of these things really manifest themselves in the same way for the same reason that you just mentioned.
Yes. Stay-at-home mom, greeter at Walmart, McDonald's drive-through worker, healthcare, it really does not matter. If you are a human, you cannot avoid stress in your life. You just have to get better at managing it. Right. And the people you see who seem unbothered, unstressed, successful, whatever word you want to put, you know, on the perception you have of those people, is not because they don't experience stressors in their life. It is because they to learned to manage them more efficiently. Okay. And that is really where you have the opportunity to grow yourself as a human.
Well, let's go ahead and talk about how to manage stress. Let's just kind of talk about some ideas that you have expressed earlier in your writings and as well as in your presentations. Recognize the common stressors and try to seek to minimize the impact. How do you get yourself into that mindset to kind of look at yourself holistically rather than just have someone tell you that you're going to get stressed?
I think first recognizing that you can't avoid it and you will experience stress in your life is important. A lot of the scientific evidence, and there's a fun study out of Harvard that tells you there are 6 things you can do to tell your brain that you are safe if you are experiencing secretion of epinephrine, norepinephrine, or cortisol. And those 6 things are physical affection. So you can go in, you can give your family member a hug, your husband, your kids, your wife, whatever. Some kind of physical affection is going to tell your brain, you're not going to die today. You're not in danger. You can also do physical activity. Generally, people think when you think about these things that I need to expose myself to a lot of them. You can do 10 jumping jacks. You can run around your car 2 times. You can run in place for 15 seconds.
To interrupt. You
don't have to go to the gym for 3 hours. You don't have to sign up for a membership. You don't have to get any equipment. It's just doing something to tell your body that I need to focus on something else. You can color. You can laugh. You can cry. There are a variety of other things, but there are generally those 6 things are going to cause your brain to say, okay, I'm not in trouble. I might not like this, but it's not going to cause me harm. And that's enough to tell your body that it can stop secreting those hormones.
That's part of the legacy of Dr. Herbert Benson, who was a Harvard cardiologist back in the 60s and 70s. And he basically showed that the relaxation response does have a physical impact on all of the issues that we talked about. And he talked about the fact that you want to have a relaxation response, which is essentially what you're talking about with those 6 or 7 steps. Kind of give yourself an off-ramp, so to speak.
For sure. Deep breathing is the 6th one. I think I mentioned 5, but as a respiratory therapist, probably the one you should remember the easiest is deep breathing. Mm-hmm. And again, it's not an hour of deep breathing, go book a massage. You can do a box breathing in 12 seconds, mm-hmm. 4-second inhale, 4-second pause, 4-second exhale. 4-second pause is enough to activate your parasympathetic nervous system, to lower your heart rate, to tell your body you're not in danger.
Yeah, it's a very important relationship. One of the other things that we talked about is that the emotional draining and the self-care, and we have, I mentioned earlier, stoicism, suck it up. You're a respiratory therapist, you're a physician, you're a nurse. And the problem with that is it kind of is self-defeating after a moment when you don't recognize what it is that's causing you to be stressed out.
Yeah. I think verbalizing it is really helpful for healthcare providers. We do have this persona that it's not appropriate or it's not professional to show our emotion or cry in front of the family. Or I think what you'll find when you interview families and what the literature tells you is they appreciate that they're not the only ones who are feeling that way. Mm-hmm. And it makes them feel more well received in their response when they're dealing with something difficult, if they're not the only one who is crying. But also, I get it. As a professional, you want people to trust you, and you can verbalize your emotion without showing your emotion in a bodily way. So you can share with someone that you are sad or that this is upsetting without having tears streaming down your face, without having your voice crack, without, being unable to physically speak. And so I think as healthcare providers, if you're comfortable in your environment, in your organization, or with your patients, kind of expressing some of that emotion with patients and families or other colleagues, that's awesome. If you're not, or if that doesn't align with your personal viewpoints, you can still share it verbally without having some of those more physical responses, which can still help with connection. It can still help by lowering stress, because naming things, sharing things is helpful in making those connections in your neural pathways in your brain. And so I think that part allows each of us to kind of do something that feels true to ourselves. And if you are someone who maybe grew up in a household where expressing your emotions or sharing vulnerability was frowned upon or not something that was celebrated in the same way it may be today, you still have the opportunity to share in a way that feels true to you.
One of the points that I noticed that a lot of our fellow therapists are taking our fact that we're breathing specialists and actually going into self-help breathing techniques and relaxation techniques and helping us drill down. It's not just getting oxygen in and CO2 out. There's actually a relationship between the mind, body, and spirit. And it's nice to see a lot of our therapists that are actually going into that area, whether it's healthful breathing, whether it's yoga. It's all basically being aware of what your breathing process can do to calm you down.
I think what all of those things do is they make you more mindful as a person on the things that are subconsciously happening in your body and around you. In the same way that, you're not aware of every beat that your heart makes, or every time a valve or a vessel opens, or every tendon or muscle moves as you walk or, do a physical action. The same thing is true for your feelings as well. And the more we can become aware of those things happening in your body, the more you have influence over how you perceive them, what stress they cause you, what excitement and joy they bring you. Because truthfully, your body's doing 10 million amazing things every second. Mm-hmm. And that is just so cool. We should celebrate that.
That's right. And one of the points that I bring home, and we'll wrap this up here in a few moments, is probably this major disruption to sleep. With chronic stress. And of course, when you can't sleep, your body can't replenish itself, it can't refresh itself, and it just leads to a vicious cycle. And basically, you have sleep disorders area under your supervision. And for the general older adults, they recommend anywhere from 7 to 9 hours of sleep a night. Is that what you hear in when you work with your people in the sleep disorder center?
Everyone everyone's a little bit different. And I keep in mind, I work in pediatrics. So little ones who are growing need a little bit more sleep than adults who are not growing anymore.
Right.
But you need enough time to recharge and reset. I think there's a lot of things happening in the industry now with wearable devices and artificial intelligence and how we take information that our body is giving us to understand more about it. I'm an Oura Ring wearer, whether you're an Apple Watch or Garmin or, there's a whole bunch of things you can use to help you figure out what's right for you. But it also depends on what you're demanding of your body every day. You might need more sleep after a 12-hour shift than you do after a weekend out with your friends or, a family barbecue or something that's a little bit more low key. And I think it really depends on what happens in the time that you're awake, how much time you need to rest and recharge.
The problem is that when this stress that you have during the day is in your mind, it's disrupting sleep. You cannot relax. So you have to find a way to try and divorce that from reality so you can actually calm down. And I just read something the other day that I've been using myself. I didn't invent this thing, but I just found into it. It's called cognitive shuffling, where what you do is you think of a 6 to 10 letter word, not one that's related to your work or stress, such as they give the example of blanket. And then what you do is in your mind's eye, you look at each letter. And you start with the B and you make up 6 words that begin with the letter B. And then you go to the second letter, L, and you make up 6 or 7 words that begin with, and all of a sudden, within 15 to 20 minutes, maybe all of a sudden you'll find yourself dozing off because it distracts you from the damn things that keep you up at nighttime.
Absolutely. And everyone works a little bit different. I think when you look at some of the literature and scientific evidence related to sleep and longevity, in your life, the one thing that continues to come up as most helpful for health and longevity is going to sleep and waking up at the same time every day. And that is really hard when you're trying to juggle a lot of rings. I wake up and go to sleep at very different times during the week when I'm working versus when I'm at home without those, work responsibilities. But I'm working to try and get better at what is more normal in terms of going to sleep at the same time every night and waking up at the same time every morning. And creating that consistency in circadian rhythm is one of the things that actually increases your longevity and health as a human. And that comes up everywhere in the literature. So, and as you do that, you may need more distraction or less distraction over time. So we may need some more of those distraction tools or relaxation tools to get you to fall asleep at 10 o'clock every night, if that's what you're saying is going to be your normal. And then over time, as your circadian rhythm resets and you get into that habit, your body will tell you without having to use some of those tools or to be more conscious about the way you engage in sleep.
Well, Katie, you've given us an awful lot of great information. Our listeners now have a treasure trove of options to be able to not only identify stress, to recognize it, but also to recognize that they need to do something about it to control it. Otherwise, their physical and mental health is going to deteriorate. And like you pointed out, we want to stop burnout. It doesn't happen overnight. It's something that's creeping and crawling into your psyche with unrelated stress that's not taken care of. Well, that brings us to another end of episode of RT Matters. We want to thank our guest, Katlyn Burr, for sharing the amazing insight, meaningful conversation. Now, remember, we always want to hear from you, our listeners. Just let us know if you have questions or comments or want additional information from this or any other podcast. And you can email us directly at feedback@rtmatters.com. And there's also a descriptive link before each host. Now, in the meantime, go out and be the best possible RT you can be. You now have some ideas about how you can impact in a positive manner your behavior and the behavior of your coworkers and your colleagues, not just respiratory therapists, but other members of the healthcare team. And you deserve nothing less than to go out and be the best possible therapist you can best. So until next time, be kind to yourself and to others. And again, Dr. Burr, thank you so much for taking time from your busy schedule to share with us this important topic. Until the next time, take care, be safe, and when all else fails, choose to be happy.